The Social Sector Committee of Parliament paid a visit to the New Amsterdam Hospital yesterday. More details in this report. The Social Sector Committee of Parliament yesterday completed a visit at the New Amsterdam Hospital. The team, headed by Junior Minister of Health Dr. Karen Cummings, included Junior Minister of Indigenous Affairs Valerie Garrido-Low, Dr. Vishwa Mahadio, and the leader of the Social Sector Committee, Dr. Vindhya Persad. Dr. Persad, in her address to the media, touched on the ongoing issue of drug shortages at the hospital.
There have been instances where drug shortages have been raised by patients, notably in chronic non-communicable diseases like diabetes and hypertension, as well as other medication for thyroids and other areas. What we have noticed is that there seems to be some difficulty between the demand or supply and procurement. So sometimes it is that the hospital may have but inadequate to supply the outpatient, may just have for inpatient, or they would have not received sufficient medication from MMU. So there seems to be shortages. However, they have received medication today, and we will have an updated list as to what is available and what is not going forward.
Director of Regional Health Services, Mr. Javon Stevens, was also present and elaborated on the system that is used by the hospital to procure drugs.
The system that we use for procuring drugs is when we do not supply sufficient amount, we then cross-check with all our centers across the region to ensure that what is needed isn't at one of those centers. When we are comfortable that we don't have what we propose to buy in the region, then we prepare a nil list. The list is prepared, it's approved, and we submit that list for quotations. Sometimes quotations takes weeks, it takes sometimes 2-3 weeks, and then we also have to send that list now to tender board, so they get approved from the best supplier based on their consideration. That alone takes sometimes 4 to 5 weeks, so as to get a procurement procedure over. So during that period, when it takes 4 to 5 weeks and you cannot supply, there will be shortage of some items during that period.
Dr. Vishwa Mahadio also disclosed that prior to the procurement process, an inquiry has to be made to the Materials Management Unit, MMU, to ascertain whether the drugs are available.
For them to be able to purchase or to decide to purchase, they first have to know,
if
one, that it's not supplied, and two, that MMU does not have or do not expect in a week or so. Right? And that is when their mechanism is going to kick in for them to start looking for quotations and whatever.
However, Junior Minister of Health Dr. Karen Cummings stated that following her team's visit, they are more informed as to the areas that have to be addressed.
I joined with my team here to say that we know where the gaps are, but we have found a wonderful team, enthusiastic team who want to give their best and to ensure that their conduct and delivery in healthcare is in line with the Ministry of Public Health's objective. I want to underscore that the delivery of the best quality healthcare services, regardless of the challenges, remain a priority. Not because of challenges we're going to compromise our healthcare. And so we want to encourage our young doctors and the senior personnel there to give up their best and to have pride as they dedicate their services, with unquestionable professionalism. The Ministry of Health is working to bridge the gap that exists in all essential areas. The ministry was engaged with some of the international partners like PAHO, because we do have a problem with suppliers, because they're saying that sometimes the suppliers don't have the quantity or the name of the drugs, and so they have a problem with suppliers. So we engage with our international partners to ensure that we have these drugs.
Dr. Vindhya Persad also underscored the need for more staff at the hospital.
The labs, they lost at least 7 to 9 people from the lab, so they have 3. Now, what you need are more medical technologists in the labs, because they also service the other hospitals. So the labs is one area. The porters or attendants, there are only 11 for the entire hospital, and the maximum number, or to function optimally, you need 38 staff. So those are just 2 areas. But maybe you can share.
Then you need help in the theater with the nurses.
Subsequent to this visit, the committee will make recommendations based on their visit and table a report in Parliament with the intention of having those recommendations addressed and implemented. Sasha Ramsvan reporting for Channel 8 News.